Well, Andrew, thank you for so much for sharing your story regarding your urination. Uh, would you tell the listening audience what you went through? What led you to decide to come here to seek help many months ago?
Um, well, you don't realize over the course of years how difficult things are getting until you finally do realize. You say this is not normal. So went to my primary care, got a referral, and when I came in and did the initial tests, I realized, holy crap, this is a really severe situation.
What made you go to your primary care in the first place? What exactly were you experiencing?
Um, Extreme hesitancy of urinating. It would take what felt like minutes to start going, and then the stopping and starting of it would go, and then all of a sudden would stop, and I'd have to push, and it was the pushing that was getting much more difficult.
It sounded like you had to try really hard to get urine to come out.
Definitely, definitely, which I don't anymore.
When you were going to sporting events or if you had to travel, did you experience any difficulties during those times?
Yeah, I would have. You'd try to problem solve ahead of time. You would get anxious about those situations. So, what am I going to do? How am I going to handle? What if, what if, what if the flight gets delayed and we're stuck in our seats and I'm
Mm,
not able to get up?
mm.
And how uncomfortable the situation is going to be. So, sporting events, yeah, you have people standing behind you, waiting and waiting, and I'm thinking, this is never going to happen. Eventually does, but it's just a really anxiety provoking situation.
Sounds like it was really impacting on how you live day to day.
It did, yeah. And just health wise also was becoming more concerning. I use CPAP for sleep, so I already have one sleep difficulty, and
Mm.
this was adding an additional problem on top of a pulmonary difficulty of having to get up frequently to use the bathroom.
Sounds like you were saying that CPAP sometimes bothers your sleep, and now on top of that, you're
Well,
adding the need to get up to go pee because you
right.
have
Well,
troubles.
the CPAP's been very helpful in improving sleep, but the problem with CPAP is every time you stop the machine to go to the bathroom, it has to restart, and the pressure has to build back up. So the effectiveness of CPAP technology isn't as good when you have to get up frequently to use the bathroom.
So you're saying that the machine has to re-ramp up to the correct pressure every time you disconnect it.
Yep, every time.
So not only do you get up ha having to go void, having to go pee, that's disrupting your sleep right there, and then now you have to deal with slowly falling to sleep because back to sleep because the CPAP now has to ramp up.
Right, and then it has another 30 or 40 minutes, whatever it's set at, to ramp back up to the therapeutic pressure. And then another hour and a half, 2 hours later, you're getting back up and starting the process over again.
I can see why you finally decided, okay, enough is enough. And then you came in here. I know I did a few tests. Do you remember what they were?
There was a cystoscopy, and then there was I don't remember what it was called, but
The flow
it
study?
was a flow study
Yeah.
of attempting to void into like a sleeve
Mm-hmm.
to see how much and how much you're able to empty
You
your
got it.
bladder. Yeah,
You got it. And then an ultrasound of the prostate to measure the size of the prostate.
right, right. So all three of those.
And then after that, you were able to see what I was looking at during the procedure as I was looking into the bladder. Some guys are really apprehensive about that procedure. What was your experience like?
Of which
The
procedure?
cystoscopy,
The
looking in the bladder.
cystoscopy. I mean, it was. I'll be honest. It was an uncomfortable procedure, but it was very quick. And and honestly, sometimes you have to go through a little bit of discomfort to get to finding success with your health care. So it was worth it.
It was worth it.
It was
Okay.
definitely worth it. Yes.
So some you were able to see exactly what's causing you to have difficulties with
Yes.
urination. A lot of guys are super apprehensive because of if you just imagine somebody looking in with a small telescope through the penile opening, guys are super anxious. So I'm glad you were able to share your experience. Uncomfortable, but it's not horrible and it's quick.
Right. Definitely.
Okay.
Definitely.
So after I looked in, after we did all these studies,
Mhm.
we figured, okay, you have a significant obstruction, blockage due to an enlarged prostate. Then you had a surgery done. What was that like?
The surgical procedure was in and out within a couple hours. It was general anesthesia. I did have for about a day and a half had a catheter afterwards for voiding because there was you know swelling after surgery. But then after that, healing went quickly, and and symptoms were significantly better within days.
When you look at, even now, if you look at the Mayo Clinic website, if you look at other major institutions, they'll tell you this TURP procedure you went through requires a overnight hospital stay or maybe even longer hospital stay. But what was your experience like?
No, I was home that afternoon. Um, so no, I did not have an overnight stay.
Now, several months later, what are your urinary symptoms? What has changed?
There has been significant improvements in initial flow of being able to initiate, being able to completely empty the bladder when I couldn't before. I'm getting up less during the middle of the night. Still get up maybe once a night. Um, I'm trying to get to the 0 point, but it's still about once a night. Um, uh, and a lot of the just effort to have to push and try to go is completely gone.
Wonderful. A lot of guys are worried about being incontinent, meaning not being able to control their urine, peeing on themselves. What was your experience?
Hasn't happened. I mean, healing right after surgery for a few days. I wore diapers because of having had the procedure, but that went away.
Purely precautionary.
Yes, yes, yeah. Yeah, I would say once the catheter was out, I had a day or two of a little bit of what I would call leakage, and then that was it, and then no more.
So it's not nothing permanent.
No, definitely not.
Yeah. Sounds like it's part of normal recovery. The other big thing guys worry about is erections after something, a TURP procedure, roto-rooter surgery like that. What's your experience been?
Um, Everything has been just as it was before the surgery. I get erections just fine. Um, um, Sex is the same amount of pleasure that was beforehand. The ejaculation is inward instead of outward, which the first couple of times was a little
Kind of odd,
strange, a
yeah.
little odd, but honestly, it really makes no difference when we're not attempting to get pregnant. So,
Well, like I said, Andrew, it matters to guys who are trying to get their wives pregnant or their spouse pregnant, and also guys who work in the entertainment, adult entertainment industry. So otherwise, it doesn't matter.
well, I admit to nothing in terms of my career. I don't do that though.
Okay, well, very good.
I'll let you know that.
Oh, very good.
Yeah.
And so, what has changed now? What has impact? How has this procedure impacted on your quality of life?
Um, well, quality of life, I would say, is significantly improved, where I'm not having to plan ahead of time as to is there going to be a bathroom? How close is the bathroom going to be? Am I going to be able to go? My sleep is improved, which just in turn improves your quality of life during the day
And your mood.
and mood as well.
Yeah.
Yeah, yeah. So overall, there's it's a significant improvement in quality of life. Yeah.
So, what will you tell guys who are suffering with urinary difficulties, like what you went through?
Don't wait. Don't wait as long as I did. Uh, get in to see your primary if you need a referral, and then go see a urologist and get this taken care of because it's well worth the testing and the short surgical procedure.
Well, thank you so much, Andrew,
Yeah,
for
of
sharing your
course.
story.
Yeah, I really appreciate it. Thank you for hearing it.
Yeah.
Yeah.